Hi and hello everyone. Welcome to the Nursing Virus YouTube channel, and this is me Logunathan, and this video regarding the Himachal Pradesh Staff Selection Commission examination which was held on the date of 4th October 2020. The professional answer keys we are going to see with that complete solutions. Already I have uploaded the part 1, the first 60 questions with a complete solution, and that furthermore 60 questions we'll discuss on this video. And so far, if you are not subscribed my channel, don't forget to subscribe and click the bell icon so you will get all my video notifications. So here we'll go with that questions and complete rationals for each question. So the first question, which of the following is considered as most important aspects of hand washing? The options are soap, water, friction, and time. So here the correct answer is friction. So that is the considered as most important aspect of the hand washing. So the next question. The founder of modern nursing is Dorothea Dix, Florence Nightingale, Clara Barton, and Mary Mahoney. The correct option is Florence Nightingale. She is the person were considered as the founder of modern nursing. So the next question, the psychology question, that is a Maslow hierarchy of needs is usually to the nurse who constantly prioritize a client nursing needs. The most basic or first level need include self-esteem and esteem, self-actualization, love and belonging, air and water, and food. So the correct option is food and water. So that is the basic need for the every patients. So the next one, lactate or ringer solution is contraindicated in hypovolemia, burns, lactic acidosis, fluid loss as bile or diarrhea. So here the correct answer is lactic acidosis. So this is the one of the repeated question from the RRB. So the next one, the tool discharged from that osteoma is called effluent, cathartics, colonic fluid, and mucosa. So here the correct answer is effluent. So this is the kind of and discharge which is coming from the osteoma. We'll use to consider or we'll use to call with the name of effluent. So the next question. So the color coding for the nitrous oxide cylinder is black, black with white shoulder, and French blue and gray. So the correct option is blue. So this is the common color in the hospital setting for using the nitrous oxide cylinder color code. So the next one, 67. Sharp instrument should not be sterilized by autoclaving, boiling, hot air oven, and antiseptic solution. The correct option is boiling. So this is the method should not be utilized for the sharp instrument sterilization process. So the next question, the most common injury among the older person is atherosclerotic changes in the blood vessels, increased incidence of gallbladder disease, urinary tract infection, and hip fracture. So the commonly among the elder population, so the fracture is very commonest problem. So among that fracture, the hip fracture is very common. And the next one, the immunity means antibodies and antigen reactions, transfer of maternal antibodies across the placenta, the level of resistance of a person to particular disease, acquired immunity by the immunization. So the correct answer is the level of resistance of a person to the particular disease were considered as definition for the immunity. So the next one, again from the sterilization. So which of the following is the moist heat method of sterilization? The options are autoclaving, hot air oven, pasteurization, and none of this above. So the correct option is so this is the moist heat method example. So the next one, the disadvantages of incinerator is that to generate because of highly toxic gases, UV rays, radioactive rays, and X-ray. So the correct answer is highly toxic gases will be evaporated when you are doing with the incinerator method. So the next one, which antibody is responsible for allergic response? IgG, IgA, IgD, IgE. So the correct answer is IgE. So this is the correct answer. So the IgE commonly will be responsible for all the kind of allergic reaction towards the human body. 73. The causative agents of plague is mosquito, Yersinia pestis, and Mycobacterium tuberculosis, Mycobacterium leprae. So the correct answer is Yersinia pestis. So the next one, 74. The Red Cross Society was founded by Henry Ford, Henry Dunant, Henry Brown, Henry Clady. So this is one of the repeated question in that Norcet examination. So the Henry Dunant is the founder of the Red Cross Society. So the next question, which committee is also known as Health Survey and Development Committee? Bohr Committee and Mudaliar Committee, Srivastav Committee and Mukherjee Committee. So the correct answer is Bohr Committee. So this is the committee were also called as Health Survey and Development Committee. So the next one, the chilling test is used for detecting of folic acid deficiency, cyanocobalamin deficiency, iron deficiency and iodine deficiency. The correct option is for detecting that cyanocobalamin deficiency, commonly will do the chilling test. So next one, the temporary hardness of water is removed by boiling, filtration, SODIS method and addition of chlorine. The correct option is boiling method. So this is the one of the temporary hardness can be easily removed by the boiling. So the next one, the National Family Welfare Program in India was launched in the year of 1962, 1958, 1965, 1952. The correct answer is during the year of 1952, the National Family Welfare Program in India were launched. So the next one, 79, Osha Worker is posted in all given below places except the community center, sub-center and field visit and super specialty hospital. So the correct option is on the super specialty hospital, the Osha worker will be never posted. So because they are the community healthcare workers, they will do all the kind of community services. And the next one, NITI Ayog was established by the Government of India on 1st July 2015, 1st January 2015, 1st January 2014, 2nd October 2015. So the correct option is on the month of January 1st, 2015, the Niti Ayog was established. So next one belongs to the psychiatric question. That is, imaginary perception is also called as delusion, hallucination, illusion and magical thinking. So the correct option is hallucination. So where the person having the imaginary perceptual problem. So the perceptual problem, commonly we have two things, that is hallucination and illusion. If the person having imaginary perception, that is hallucination. If the person with the stimulus, if they are having any imagination, that is called as illusion. So the next one, the which therapy is used for treating the phobia? Abortion therapy, ECT, systematic desensitization and hypnosis. The correct option is systematic desensitization. That is a gradual reduction of person fear. So next one, the Mental Health Act was established or passed in the year of 1955, 1956, 1987, 1992. The correct option is C, 1987. The next question. The duration of ECT is about 0.1 to 1 second, 0.1 to 1 minute, 1 to 2 minutes, 20 to 30 seconds. So the correct option is 0.1 to 1 second, the ECT shock can be given. So next one belongs to that mania. That is the stage of mania which is characterized by intense sense of happiness is the four stages they given, that is euphoria, elation, ecstasy and the exaltation. The correct answer is on the ecstasy. The person will used to have the intense sense of happiness. That is a delusion of grandiose. So next one, the disease is characterized by 4 A's according to the Eugene Bleuler is MDP, OCD, schizophrenia and delirium. So the correct option is schizophrenia. But even in the professional question, they given the wrong answer for this question. So they given us delirium for this disorder. But actually for the schizophrenia only we have the 4 A's according to the Eugene Bleuler. So the next question. The immediately before expulsion of fetus, which of the following cardinal movements will used to happen? That is descending, flexion, extension and external rotation. The correct answer is extension. So this is the cardinal sign or cardinal movement will used to happen just before delivery of or expulsion of the fetus. And the next one. An important landmark of pelvis that determine the distance of the descent of the head of the fetus is known as linear terminals, sacrum, ischial spinous, ischial tuberosities. So the correct option is ischial spines. So the next question, and 89. Yearly amniosynthesis is done in which period of pregnancy? 12 to 14 weeks, 14 to 16 weeks, 16 to 18 weeks, 9 to 11 weeks. So the correct option is 14 to 16 weeks. So mainly for detecting any kind of chromosomal or genetic abnormalities. So next one. The placenta should be delivered in within how many minutes after the delivery of the baby? 5 minutes, 30 minutes, 45 and 60 minutes. The correct option is within 30 minutes of the baby expulsion, the placenta also need to be expelled. So the next one, which of the following fetal position is most favorable for the birth? Vertex, transverse lie, frank breech presentation, posterior position of the head. So the correct option is vertex. So this is also one of the repeated question. And then 92, and in fetal blood vessel, where is the oxygen content? Umbilical artery, ductus venosus, ductus arteriosus, pulmonary artery. The correct option is ductus venosus. This is also a repeated question. So next one, the anterior fontanelles is ossified in which duration? Soon after the birth, at 6 weeks, at 18 months, at 5 years. At that 18 months period, at mean 1.5 years, the anterior fontanelles will used to get fused. That is also one of the questions repeatedly asked. 94. The freshly prepared ORS, oral rehydration solution, should be used within 12 hours, 24 hours and 36 hours and 48 hours. So the maximum is 1 day. That is a 24 hours we can use that once prepared ORS solution. So next one. Which component lack in the human blood? Calcium, vitamin D, IgA and magnesium. So nowadays on that many of that females or the men were having the issues with the vitamin D. 96. Severe muscle wasting, growth failure and loss of subcutaneous fat are features of which of the following? Kwashiorkor, beriberi, scurvy and marasmus. So the correct option is marasmus. So that is one of the protein energy malnutrition. So next one. Which of that antidote for that streptokinase? Protamine sulfate, aminocarboxylic acid, naloxone and vitamin K. So the correct option is B, aminocarboxylic acid. So next question. The first sign of digoxin toxicity is most likely to be headache, dizziness, anorexia, nausea, and emesis. So the correct option is anorexia. So the next question, which of the following is injected deep IM by Z technique? Zinc, iron, calcium, and vitamin C. So commonly the iron can be given with that Z technique of IM injection form. So next one, which of the following is the functionally active form of vitamin D? So the correct option is calcitrol. So that is the common thing will used to given or prescribed for the patients. So next one, the term bacteria was coined by the author Ehrenberg. This is the person who coined the bacteria term in the first time. So next one, the component of cell wall of fungi is cellulose, pectin, chitin, and dextrin. The correct option is chitin. So next question, irregular nuclei are present in neutrophil, basophil, eosinophilia, and monocytes. So the correct option is neutrophils. So that in a neutrophil, the irregular nucleus can be present within the cell. And that 104. Collagen fibers are characteristic of which tissue? Muscular, epithelial, connective, and nervous. So the correct option is connective. So the connective tissue, the collagen fibers were commonly seen. And that 105, the plasmolysis will occur when the cell is placed in hypotonic solution, hypertonic, and isotonic, and none of the above. The correct option is hypertonic. So the next one, the cell membrane is, the options are semi-permeable, permeable, selectively permeable, and impermeable. So the correct option is selectively permeable. So next question, most common monomer of carbohydrate is glucose, fructose, sucrose, and maltose. The correct option is fructose. So this is the most common monomer of carbohydrate. And the next 108, in meiosis and synapses occur during interphase, prophase, S phase, and leptotense. The correct option is propase. So during the propase will used to happen. And 109, and testosterone is secreted by Leydig cells. So the next question, at the time of implantation, the human embryo is called as embryo, blastocytes, zygotes, and fetus. So the correct option is blastocyte. So during the time of implantation process, the embryo commonly called as blastocytes. And ovulation occur under that influence of luteinizing hormone, estrogen, follicle stimulating hormone, and progesterone. So the correct option is LH, that is the luteinizing hormone. So the next question, amniosynthesis is withdrawal of amniotic fluid during menopause, lactation, gestation, and parturition. So the correct option is during the time of gestation, the amniosynthesis, that means withdrawal of amniotic fluid, can be taken out. And the next one, the sickle cell anemia is autosomal recessive inheritance disorder. So the next question, DNA nucleotides are attached by hydrogen bond, covalent bond, van der Waals bond, electrovalent bond. So the correct option is hydrogen bond. So next question, interference are antibacterial proteins, antiviral proteins, complex proteins, and anti-clotting proteins. So the correct option is antiviral proteins. So next question, which is the respiratory disorder? Polio, arthritis, asthma and cancer. And this is one of the easy simplest question. So the asthma is considered as respiratory problem. So the next one, hepatitis B virus is known as hepatinavirus, variola virus, retrovirus and picomavirus. So the correct option is hepatinavirus. So the next one, streptomycin is produced by the Streptomyces gracius. The correct option. So the next one, dermatoglyphics is connected with skin disease, skin care, cosmetics and fingerprinting. So the correct option is fingerprinting. So last question from this section, that is 120. The DNA element with ability to change its position is called as citron, transposition, intron and recon. So the correct option is transpone is the correct answer for this question. So I hope this complete presentation can be much helpful for upcoming all kind of examination, and the remaining GK questions and English and grammatical questions will upload soon. And thanks for joining with me, and don't forget to like and share and subscribe my channel. Thank you.